My name is Tali Lanfir. I started feeling strong pain down my right arm, along with numbness and weakness. I couldn't brush my teeth. I couldn't press the hand soap. And the whole day I was walking around, rubbing my arm like that in deep pain. And I did not even know that it could be related to a spine issue. However, I was told by my doctor, well, the doctor at the hospital that I went to, because I got to the ER with pain, he said you need to see a spinal surgeon because they did a CT and they thought that they need to investigate deeper. And so I went to Florida Spine Associates. They have an excellent name in the industry as amazing surgeons. And they did do an MRI for me and realized that I had nerve compression in my cervical spine, the upper spine, and that this was causing my arm to go numb and weak. And unfortunately, this was quite an urgent situation where I needed to get operated on within a week or two, or else I could go paralyzed. So I wasn't left with too many options. The paralysis could go to other areas, yes. I saw Dr. Norton. He was an amazing surgeon and amazing advisor in helping me make the decision. He operated on me at the end of April 2023. The result was amazing. I came out the same day, even though, with a little bit pain of surgery, but there was no pressure on my arm. Numbness was gone. So after I left the ER and they told me that I need to see a spinal surgeon, I knew right away that the best choice would be to go back to Dr. Norton, being I had excellent experience with him before. And we made an appointment that day for the following day to come see him. He accommodated me real quick, set me on an MRI with a stat order, so the insurance approves it quickly. And we got a pretty quick turnaround before the surgery. It took only 2 or 3 weeks to get approved and an appointment for the surgery. Dr. Norton is very self-composed. He doesn't stress, even when you have a big problem. Very reassuring, very compassionate, excellent bedside manner, and he's well known in the area to be the best of the best when it comes to spine surgeries. So after surgery, I knew I'm going to need to do physical therapy for a few months. Of course, at Florida Spine Associates, they don't limit you. You could choose to go on location or you could go to any other physical therapist. But I had no doubt that I'm going to go at the same place where I got operated with the same doctor. There's always an involvement. If you have a question, you can always go in and ask the nurse. The physical therapists there get your information directly from the surgeons. And it feels like all in one place, which to me was very reassuring. It's the same practice of the doctor who operated on me. I felt very confident that they could bring me back to what I was. And as I mentioned before, you have just a window of a few months after surgery to bring back your strength. If you don't act on it, you lose it forever, pretty much. So I just knew that with the guidance of Dr. Norton and the support of Andrew, who is an outstanding physical therapist, I knew that I'm going to be back to what I was before. I should mention that I was a swimmer before the whole situation occurred with my right arm. I swim 100 laps several times a week. And I was very nervous, taking a break to get the surgery, to get the recovery, and then you need a few months before you can start, swimming again. I was very nervous. I'm never going to be able to swim in the same way, but with the help of Andrew and the whole team, I'm back to where I was before. My normal routine, walking my dog, swimming. I own a business. I'm very active. I have 3 teenagers at home, so I'm back to my old life. What I liked about physical therapy at Florida Spine Associates, and especially with Andrew, is that he was very friendly, as well as everyone else in the office, whether it's the front desk receptionist, whether it's the other physical therapists. There's wonderful atmosphere there. And you always see patients walking in, bringing something nice for them, whether it's cookies, whether it's like a snack, chocolates. You see that everybody really appreciates the team there. And that includes me. I used to try to spoil everyone there. They're extremely nice, very understanding, always accommodating to whatever it is that I needed. If I needed to finish 10 minutes early, come 10 minutes late for some reason, of course, They do have a full schedule, but they're very understanding to everyone, very nice. And especially they always ask you, how do you feel today? So if I had a rough day that I would come with, some sort of a pain, whether it's my arm, whether it's my back, they would always spend a few extra minutes, Andrew it is, whether it's massaging me with manual manipulation, aside from the exercise, it's always wanting to make sure that I felt at my best when I came out. So the process itself, I would say, was not painful at all. It shouldn't be painful. It should be almost like working out at the gym. Yes, you strain the muscle and then you take a day or two to rest and then you come again. They don't overwork you to the point that you're suffering or, nervous about coming the next time. How am I going to do it? But you feel comfortable that they give you something within the means of your ability. And I saw people that came after more painful surgeries and bigger issues than me, and they started from scratch with them very slowly and gave them stuff, assisted exercises. So I know that they tailor the exercises to whatever you need, with a lot of sensitivity and compassion. And I'm very thankful to Florida Spine Associates. And even as January approaches and I have to renew my health insurance, the first thing I always check is that Florida Spine Associates will take the new insurance I'm with, because this is my number one choice and number one importance. After 2 surgeries and physical therapy, I would like to stay with this practice.